I remember coming into your office that day, and I was really looking for someone that was relatable and could understand where it was coming from, especially in terms of like past symptoms. So I had a lot of ear issues. I had damage in my joints. I also had like bleeding ears, lots of structural issues. And I remember our consultation, and I remember watching you specifically, giving me an answer for the first time that I had never had before. I get so emotional, sorry. Okay. I think the reason why I chose you, no, I know the reason I chose you. I remember watching you, and you're sitting there and you're like, okay, I think I know what this is. And I remember watching you just kind of move through the process of solving my problem. And I think that was when I said 100%. I'm like, okay, if you can give me like a solid answer. It was so cool because your eyes were like, okay, you have this kind of like where you're going, okay, I'm processing, I have no idea where can this go. And then I remember when you lit up, you're like, oh, I know what this is. And I was like, what is? You're like, oh, I know what this was. And you finally gave me that solid answer of having juvenile idiopathic arthritis. And the more I dug into that, the more sense it made. And for that, to have that diagnosis after years of pain, doc, it was my answer for who I wanted to work with. And you know, there's a lot of sacrifice to being in LA and having that being a distant patient, but it was 100% worth it, knowing that I could trust you to solve any problems in the future or work through it to give me a solid answer. I'm doing really well. I tell people all the time, I think I was on day 3 or 4 after surgery, right after surgery, super puffy, very big, and you know, whatever. But my body, I remember going to sleep that night and waking up at 5 in the morning and just being so full of life. My body was ready to get up and go. It was like, okay, we've slept enough, which I have never done before. We've slept enough. We can go ahead and go do something. And I remember that energy and just thinking to myself, if I had to do this over, I would, just for the fact that I can breathe. So now we're at 8 months. I have been able to run better. I've been able to breathe better. I've been able to sleep better. And overall, my person as a mom, as Seini, as my roles in whatever I am, showing up more than where I was before, because that pain is no longer. I think, first of all, it's normal to be scared. It's normal to have nerves and to hesitate. You know, fear is something that actually it can be used for either bad or good. But fear is more of a placement saying, hey, there is a possible shift. It doesn't have to be negative. And I'll admit there's a lot of, you know, fearful feelings, but that's normal. Like, it's normal when you're stepping into something new. It kind of says, hey, put down your alertness. But taking that step and actually trusting your surgeon and finding a good surgeon who you can create with and talk to and have that kind of personal relationship, I think that really puts you forward, as well as having a good team behind you. Because I know without the whole team, I wouldn't have been able to be emotionally, mentally, and physically stable to move forward through to surgery. 100%, because your mind is extremely powerful, and I love that. Here it is that patient focus, because it does take a village, and you are going to need support. And a lot of people, you know, you can't go into this saying, oh, I'll just do everything strictly by myself. It's not possible. And that's why I love the team approach so much. Like, number one, you gotta find your correct surgeon, the surgeon that kind of vibes with you, for real. If you are not comfortable and confident in your surgeon, that's how your whole journey is going to be. Regardless of if you have a team approach or not, because you are not comfortable with who you're working with. So one, find a surgeon you're comfortable with. 2 is you do need a lot of support afterwards. So find somebody that is going to see you at your worst. See you, for me, I had a moment when I was like, my lip is busted, and I'm just so emotional. Someone who can be with you when you're extremely vulnerable, but someone that you can trust with all of those emotions and physically as well. I would say, third, definitely, if you're going to consider doing double jaw surgery, you need to also consider doing myofunctional therapy because they go so hand in hand, for sure. So those are the top 3: surgeon, someone support team after, and doing myo.